For this audio, my supervisor did not want to speak, so we had a private conversation, and I'm going to explain about what we spoke about. Task 1 is cleaning a cage. We'll use F10, water, and paper towel. F10 is measured through mils, and we calculate this dosage through a syringe. Water is from the tap and measured with a measuring cup. We mix them together, and then with a funnel, it is poured into a spray bottle. With printing, paper and ink is measured by daily usage. So paper is printed on request for admissions, certificates, and hospital forms that we use for surgery, or forms that we use for our boarding animals. And the ink is measured by being replaced when the cartridge is empty, and a cartridge lasts about a month. At the end of every day, we have to mop the whole vet. So we do this by measuring 1 litre of water, which is hot out of the tap, and we pour it into the mop bucket. And then with a syringe, we measure 10 mils of F10, and we mix it into the mop bucket, and then we will then mop everywhere in the vet. After surgeries or dentals, we have to wash the instruments. We wash them in hexo wash, which is diluted with water. We do 4 mils of hexo wash, which is either a cap full or we use a syringe to pull out 4 mils. We then mix that in with a litre of tap water, which is warm, and we either just do half the sink or we measure with a measuring jug. After the instruments are washed, they then soak in 700 mils of F10, which is changed every 2 months. When cleaning a hospital cage, there is hazards. You can ingest the F10 by breathing it in, or your skin can react to the F10 by touching it. This doesn't happen to everyone, but if you have sensitive skin, it's a possibility. And when cleaning cages, you can get a bad back if you're bending too much or squatting wrong. An improvement for this would be using ergonomics. So ensure that you aren't using your back muscles, using your core muscles, you're squatting correctly, and ensure that the paper towel with chemicals is placed into the appropriate bin, and that if it has bodily fluids on it, that it is placed into a clinical waste bin, and ensure when the bin goes out, everyone knows to make sure it's not easily accessed by animals. So ensure F10, even diluted, does not go down the drain or tipped onto any grass, because you're just going to hurt any wildlife that's there. For admissions and printing, there's lots of paper used, and it doesn't help our trees, so we want to be using recycled paper and to not print if we don't have to. So maybe receipts or any paperwork that can be emailed, we'll do that instead of printing. Hazards with printing is we get paper jams and people stick their fingers in trying to unjam, so you can get your fingers stuck, or paper cuts on paper, any spills from the ink. Mopping, there's a lot of water wasted, but again, you kind of can't stop that, so maybe just make sure that as an improvement to use less water, not use too much if you don't have to. Tip water into another bucket that can be disposed of a different manner, so then you're not tipping the F10 and all the dirty water down the sink. Use signage to let everyone know that the floor is wet or will be wet. Mop room by room, minimizing the risk of slipping. Because hazards are burning yourself on the water if it's too hot, skin reacting to the F10 if you're not wearing gloves, and slipping on the floor if you're not going to put signage or you're just going to mop it all at once. Cleaning surgery instruments, so they are cleaned multiple times a day. lots of different packs of instruments will be used. Hazards are you could burn yourself if the water is too hot when washing. Gloves will need to be worn, as the Hexo Wash and the F10 isn't very good for your skin. And it also works as a barrier if you were going to cut yourself on an instrument. And for improvements, if possible, to do one big wash at the end of the day or 2 big washes, and find an environmentally friendly wash that it can just go down the sink and it's not going to infect any wildlife or the system ways.